Generally, they are different, but there is evidence that maybe they're starting to become some bleeding together, no pun intended, of those things. So we wanted to collect more evidence and cover many of the things I've talked about. So we set up a One Health consortium funded through an AMR Theme 3 project from the UK Research Council. This is a £1.5 million project. Thank you. If you've ever paid any tax, you've probably paid for it. We included farm animal vets, small animal vets, GPs, public health, genomics to try and understand this idea, and then modeling and statistics and things I don't understand to try and kind of make sense of all the data. And I've noticed that my name's not on there, but I'm the lead of this project, which is probably the right thing to do. So what are we studying? Well, we started in January, so I'm not going to tell you really what we found. I might give you a couple of anecdotes if I've got time. But basically, what we want to study is what are the risk factors on farm for the presence of antimicrobial resistance in farm animals. So yes, of course, it may be that the use of antibiotics drives resistance, but maybe the use of heavy metals does, maybe the use of disinfectants does. Maybe spreading manure on fields and then getting your animals to graze that field and therefore potentially cycle the resistant organisms around. Maybe that's not a good thing to do. Maybe housing them all together is a bad thing. Maybe housing them all separately is all that. We don't know, right? So we're recruiting 80 dairy farms around a geographical range, and we're going to take samples every month from those farms where we're going to look at AMR levels in E. coli, and we're going to do surveys and observe their practice to see what's going on. And at the end of that 2-year process, we're going to understand what actually drives resistance in farms. The idea is that we can potentially do something about it. Do dogs pick up resistant E. coli from the near farm environment? This is a wonderful thing called experimental dog walking. Okay? Fido comes along with you, walks along a field for 6 months every day. At the end of it, poos into a bucket, and then we say, they can do that. You can train them to do that, apparently. And then you take a sample and you go, right, has the dog picked up resistant E. coli that we found on that public footpath? Went through that herd of cows, okay? Ultimately, does this link to human urinary tract infection? So as you know, every urinary tract infection is, many urinary tract infections are microbiologically examined. So we're going to take all of the E. colis that are resistant, and we're going to look at all of the E. colis and see whether they're the same as the E. colis we find in animals in that environment. And the final thing that we're doing at the same time is we're looking to see whether antibiotic usage reduction actually does reduce AMR. That's not just on farms, because they are reducing the use of antimicrobials on farms, but you're also reducing antimicrobial use in human medicine as well. And so we can use these urinary tract E. coli in human medicine to see whether antimicrobial resistance rates are falling on a GP practice to GP practice basis when those GP practices reduce antimicrobial usage. So we're monitoring usage, we're monitoring resistance in real time over a 2-year period for every E. coli and actually non-E. coli. And we're going to go back as well 10 years and look at preliminary data and look prospectively as well. So it's going to be a study to understand whether or not usage reduction is actually doing anything to resistance. And it might not, because of these issues around co-selection of resistance that I've talked about, where using one thing selects resistance to all the things. Just reducing one thing might not be the answer. This is our study zone. So this is Bristol, this is Bath, this is kind of Wells, Glastonbury, this is kind of Swindon. So we're kind of a 40-mile diameter circle. Each one of those blobs is a GP practice, so the urines that we look at will be coming from them. The farms are dotted around amongst them. The dogs are dotted around amongst them, 400 dogs. I'll conclude and open it up for questions, and just to say that antibiotic use clearly drives resistance in humans and in animals. There's no doubt about that. There's no argument about that. But it's not just antibiotic use. Other things can drive resistance as well. Disinfectants, heavy metals, maybe other chemicals in the environment. Anne's going to talk later perhaps about some of these things. Resistance was always there, okay? Resistance hasn't happened in a vacuum. There are some cases where resistance happens by mutation and therefore can happen in an environment which is closed, but most resistance has evolved by movement of resistance into something. So it's about an open system. If your cow is kept in an oxygen bubble, it will never develop resistance, probably, to something like a third-generation cephalosporin in E. coli in its intestines. Can't happen. But if your cow's grazing the fields and you're spreading pig manure on the fields, then clearly it's an open system and things can come in. And people are part of that open system. Zoonotic pathogens, so disease-causing organisms from animals moving to humans. We're not going to doubt that. We see it all the time. And resistance in those, things like Campylobacter and certainly Salmonella, that can be a problem for those patients. We don't doubt that. And so that in itself should be a reason to reduce antibiotic resistance in animals and therefore antibiotic usage. And we are doing so. But the problem is that this idea of opportunistic infections, this normal flora, that's the thing that everybody argues about. And actually, there's very little evidence that for normal flora, for your E. coli's, for your Klebsiellas, for your Enterococci, that there's any real significant overlap between the two. But I suppose it doesn't really matter, because we all should be reducing antibiotic usage, and we all should, therefore, be aiming to reduce antibiotic resistance. But actually, we don't necessarily know that reducing antibiotic usage will reduce antibiotic resistance. Hopefully, the project that we're doing and other projects funded at the same time, and the work that you're all doing as well, will help inform a lot of these and take us forward into the next 10 years, which is kind of the aim of this conference. Think about that, to understand interventions and how they might work and how they might be deployed in future. Okay, thank you for your attention.
Any questions for Matthew? Yeah.
Hello. I just wondered if you include organic farms in your study.
So the 80 dairy farms that we're using will include all different management practices, include dairy farms, include farms that use homeopathy, all sorts of different things. And we're not currently seeing any significant difference between them in terms of resistance levels.
Hello, yeah, I am a cattle vet down in Cornwall here now. I just wanted to give you a couple of points and then ask you a question. Most of the time when I prescribe antibiotics, and most of my colleagues, it's usually a 3 to 5 day course. Rather, we have got long-acting antibiotics, but we wouldn't just reach straight away for the.
So you say you're a farm animal vet?
Yeah, I'm a farm animal vet.
Yeah, okay, so that case was about small animal
Yeah, that was
practice.
about cats, and I don't really know too much about that. The other point I was making is the farmers do have an arsenal of, if you like, of drugs in their cupboard. But again, because of the milk withdrawal period, which I don't think you perhaps spoke enough about, they wouldn't just blasely use the antibiotics because they're not allowed to put the milk in the tank if the animals are on antibiotic and they have this withdrawal period afterwards.
So I didn't want to get into the details of withdrawal because that causes a number of problems in its own regard. So, for example, when you reduce the numbers of critically important antimicrobials that you use, what you're driving dairy farmers to do is to use cefalexin, for example, which has got a 0 milk withhold time. And we're seeing that rising, increasing. And the problem is cefalexin, as a first-generation cephalosporin, can still select all of the same things that give. So, milk withhold is a complicated issue. I do realize that. But the issues around dosing are still absolutely true. And, of course, I was talking more generally in terms of not just milk, but other things.
But the question I had actually was, what resistance are you finding in E. coli in farm animals?
Sorry?
What resistance pattern are you finding in E. coli in farm animals?
So in dairy cows, healthy dairy cows, and the environment, we're finding very high levels of streptomycin resistance and amoxicillin resistance, above 80%. We're finding very high levels of tetracycline resistance, above 50%. We're finding virtually no fluoroquinolone resistance, and we're finding maybe 5% cephalosporin resistance, of which half of that is third-generation, fourth-generation cephalosporin resistance, primarily caused by CTXM production. So what we were expecting to find in a relatively low antimicrobial usage industry, which is dairy, less on the critically important antimicrobials, less resistance than you might expect in the human population, less than you might expect in pets, about less than in pigs and poultry, at those sorts of levels. But it does seem to vary from farm to farm. And farms that have multi-species, so farms that also have significant pig production or poultry production, have got higher levels also in the dairy cows as well. And we've got long-term effects. So, for example, farms where they've used housing that's been used previously for poultry, and then the same housing is now used for cattle. Even we've got one farm where it was stopped 13 years ago. They stopped using the housing for poultry. Those cows have still got far more CMY producers than you would expect to find in the other farms. So it's quite early days, it's quite anecdotal, but those are the sorts of levels we're seeing.
Any further questions for Matt? There's one over here.
Hello, sorry. I'm a nurse and also from family background, and I'm just wondering if there are any statistics from soil testing with regards to persistent dog walking across farm grounds, where it can be the reverse, where dogs can contaminate cows. Is there any evidence of that, please?
There's no evidence of that. But that doesn't mean it's not happening. People have not really been taking samples. We're taking samples on up to 5 footpath sites on every farm that we visit every month for 2 years. And that involves someone putting some sterile overshoes and walking up and down and then finding what bacteria and resistance on those samples. When we started this in kind of January, February time, we were seeing virtually nothing, okay? And then all of a sudden, boom, we got this big spike around about mid-March, and being an ignoramus, I was kind of, oh, what's happening? What's happening? And of course, they're all spreading slurry on the fields, okay? So that's now a cycling of slurry, manure onto it, so we're seeing that. It may be that that'll die away. We don't know yet. We're not there yet. If I come back in a year, we might then start to see the summer dog walkers, and we might start to see more humanization of those footpaths because the dogs are more likely to have but it tends to work that way. Humans influence their dogs, and then potentially dogs could influence the environment. So we don't know is the answer. But given the volumes of excreta, I think it's more likely that the farm animals are going to contaminate the land than the dogs. We've not gone to the point of, when people put their dog poo in a bag and then throw it in a tree, right? You see that a lot. It's like baubles, like Christmas. Yeah? We've not got to the point of started opening them up and sort of finding out what's going on. Apparently, ethics to do that is almost impossible because apparently that feces is still owned by the person who disposed of it. You're not allowed to do anything with it.
Have you got any final questions at the back?
I'm aware that in the southwest, there's a lot of people with chickens in their backyard. Is there a definitive link between chickens in the backyard or garden?
No. There's no definitive link, but that doesn't mean there's no link. I think, my wife's practice, as a small animal veterinary practice, they see a lot of this, backyard chickens, and it's actually an interesting study. And small holding in general, people with a few animals, it's kind of an interesting thing. It would be a nice study to do to try and see what's going on, because they're going to be fed food, scraps quite a lot, and therefore there's a potential cycling through that way. So it would be an interesting study. It's just getting that sort of thing funded is quite difficult, but yeah, it'd be interesting to try and do it.
Yeah, go on, one more question. I don't want to stop the question, so one more question.
Do you think the current practice of spraying human effluent, you're talking about farmers spraying something, well now it's human, is that going to have the reverse effect? Is that going to complicate the whole picture?
Yes. Now the bar's open. There's obviously around the world human effluent spreading has been happening for a long time, and there's lots of studies that suggest that when it happens, then it really contaminates the land. For some resistance mechanisms, it might only contaminate it for a month or so. Particularly the E. coli-driven resistance, it doesn't last very long in the soil. But for some, You know, it could be a lot longer. It's not a great thing, I don't think, personally. But we've got no evidence that it's a bad thing.